I don't think masks are going to be around for everyone forever. I think we're moving very much from a collective public health responsibility of wearing masks to much more individual, personalized choice. So as we think about all the mitigation strategies we've had against COVID-19, I like to think of it as the Swiss cheese model. One piece of Swiss cheese on its own has got a lot of holes in it, so things can pass through. But if you start layering up a stack of these pieces of Swiss cheese, you start to have actually a pretty solid piece where not a lot of things can go through. So masking on its own is like a piece of Swiss cheese, right? It's good, but it's certainly not perfect. But if you start adding in your vaccine as another piece of Swiss cheese, your treatments, your antiviral treatments as another piece, testing, social distancing, all these other pieces, we had a pretty good barrier. What's happened now with widespread vaccination and boosting is that on its own is a pretty solid piece of Swiss cheese without many holes. So we're able to start to pull out some of these other mitigation strategies that we've used, such as masking, as being less required. Also, we're seeing less transmission in general with less circulating virus, which is why we're able to ease back. Personal comfort around masking is going to be really interesting, and everyone's going to have different thresholds for what that means to them. So we're going to see restrictions lifted very globally, but you're going to have to consider how you address each of those scenarios. So I can give you two examples here. One may be going to the grocery store, where you can go into the grocery store pretty quickly, you can do much of your shopping without really interacting with other individuals except at the checkout register, and you may feel comfortable not wearing a mask in that setting. You then may go to a concert or a show which is packed with individuals and a lot of loud noise and loud shouting, and you may feel less comfortable being unmasked and choose to wear a mask in that environment. So again, you may not be masking all the time, but you may have different scenarios where you choose to wear a mask based on your perceived risk. We really have to respect individual choice around the use of masks and never judge anyone if they're choosing to wear a mask or if they're choosing not to wear a mask in settings where masks are no longer required. One-way masking is a phrase we're hearing more and more about. We've been living in this environment where everyone's masked, so that's two-way masking, but we're going to move into this environment where it may be that one individual is wearing a mask and one individual is not. That's known as one-way masking, and is that actually helpful? So it's certainly not as helpful in terms of reducing transmission as when two individuals are wearing masks, but it is more helpful than when no individuals are wearing masks. So there are studies looking at what the level of filtration is with one-way masking, and similar to what we've discussed around the efficacy of other masks, the same is true in one-way masking. So cloth masks are less effective than surgical masks, which are less effective than N95K, N95K, N94 masks, but some masking is better than no masking. So again, if an individual is making a personal choice to wear a mask, there is some benefit to that individual who is wearing the mask and to individuals around them. I think we're going to continue to see some requirements for mask wearing in certain environments, certainly in any healthcare settings or nursing homes where risk of transmission is higher or where there may be more individuals with COVID-19, you're still going to see masks being used. You're also going to see masks being used in households where there's potentially multi-generation individuals living, or individuals with high-risk conditions, immunocompromised, children who are not yet eligible for vaccination. So I think in those kinds of settings, you will still see masks being used frequently. I also think we're going to see masks coming in and out depending on the trajectory of the pandemic. For example, if we get a new variant coming along where the vaccine is not as effective, we may see masks making a resurgence again. So it really depends on where you are, right? Because the CDC has actually updated the criteria for areas of high risk and low risk. And if you're in an area of high risk where there's high transmission of COVID-19 and you're not vaccinated, you should certainly consider wearing a mask. In areas of low transmission, actually, you really have to make an individual choice about that if you're not vaccinated, but there is no requirement to wear a mask. Obviously, you've got to weigh up the risks and the benefits for yourself in that situation. So I think we've actually seen over the last couple of years that transmission of all respiratory viruses has gone down because of our use of masks. So if we have a bad flu season, for example, wearing masks will actually prevent transmission. So this will fall into that personal choice around wearing masks, which may reduce risk of transmission of other circulating respiratory viruses.